Thank you, Governor. Good afternoon, everyone. Thank you for joining us today. I want to say thank you also to the Governor for the updates that she shared. Also want to say thank you as well with the appreciation that she mentioned. The Governor has really put together a thoughtful approach that's built around science and public health practices. And our focus is to continue to make it so that you have that information to guide your ability to continue to follow the rules. I agree that if we can continue to stay in line with those steps going forward, understanding the social distancing, the masking, the hand washing, knowing that that's what's needed to keep the virus from spreading from one person to another, we can continue to take these steps forward safely and with confidence. To get into our data, we have 249 new cases today. I want to thank the entire team of people that contribute to us evaluating these cases as well as identifying them. Our total number of positive tests is now roughly 10,800 out of the 85,000 tests that we have done as a state. There are 312 people currently hospitalized. Of these, 71 are currently in the ICU, and 52 are currently on a ventilator in the intensive care unit. Sadly, we have 11 additional COVID-19 associated fatalities to report. 2 of these people were in their 50s, 6 of these people were in their 70s, 2 people were in their 80s, and 1 person was in their 90s. These 11 people included 1 person from the Rhode Island Veterans Home, in addition to the 2 fatalities at the Vets Home that we sadly announced yesterday. The passing of these people and the people we have lost in the last several weeks is incredibly challenging and hard for the families involved. That's why it's important that we send out our hearts and prayers to them. Particularly with Mother's Day this week, which so many of us associate with warmth and smiles and gathering with loved ones, it makes it even more difficult for this time around. Please know that our deepest thoughts, prayers, and condolences are with you. In addition to sharing the data for the day, I really want to reiterate that the prevention measures we have been talking about are more critical now than ever. We've had all of this time during the stay-at-home order for people to get accustomed to what's needed and how to do it, and now's the time to really make sure we go forward. This is especially true about wearing your cloth face covering. More people being out is going to mean more people interacting face-to-face. If people are interacting face-to-face and are not wearing face covers, the respiratory droplets that I've spoken of that carries the virus when we talk or sneeze or cough, those infectious particles through the droplets would continue to spread. Infection rates would then go up, and then we would have to adjust the approach to loosening the restrictions. Nobody wants that to happen. No one does. With following the rules that we have, we can really make this progress go in the way we all want it to go. It is in our hands. We all have the ability to keep Rhode Island moving in the right direction and to help us reopen fully, safely, as soon as possible, steadily. To make that happen, we have to act responsibly. And we've spoken of the trust that we have in Rhode Islanders. That means wearing your cloth face covering, washing your hands throughout the day, implementing social distancing at least 6 feet apart from those who are not from within your household, and staying informed about what is and what isn't allowed in Rhode Island. We know that there are a lot of rules and that in some instances they have changed over time, which is important. We appreciate you being with us and following and continuing to be flexible, as the governor has mentioned. Finally, I mentioned Mother's Day earlier, and I want to circle back and say a few last words about the holiday. For everyone celebrating Mother's Day, when in doubt, keep the governor's words in mind. Keep your network small and stay close to home. Stay home and get together virtually on the phone if you can. If your mom, your grandma, your aunt, or anyone else you love is in a nursing home, that is especially true. You cannot pay a visit in person this weekend. You will not be allowed in, so please don't even go, and think of other creative ways. Don't go to the window to say hi. We know how badly you want to see your loved one, but being there in any way can sometimes be even more challenging. We want to spend this time not just thinking about what can't be done, but looking creatively about what can be done. What can you do for Mother's Day? We want people to focus on that. You can call your family, call the mom in your life this weekend, do a video chat if possible. Just hearing someone's voice or connecting with them is such a tremendous gift, especially during this time. Many people out there are probably feeling isolated at times, but having the warmth and familiarity of a loved one's voice can be so powerful in addressing that in times like this. Another gift idea for this year is sending a promise. If you don't normally talk to your mom, maybe that promise is a weekly phone call for going forward, or maybe it's something you will do together in the future, or another form of a video chat that you can perform in together. We all need things to look forward to, and this is a great weekend to reflect on that and to be thankful for all the blessings in our life. So that's something that we can focus on together as we stay close to home through this weekend. With that,